Now, more than ever, communities need educators, healthcare professionals, and government workers at local, state, and national levels to be there. There to help. There to heal. To teach. To serve. In the past, being there meant literally being there, in schools, clinics, offices. But our world is changing. Being there has new meaning. In Mooresville, one of the lowest funded school districts in North Carolina, educators have implemented mobile learning to improve graduation rates and increase competency levels. Visionaries in Amsterdam have created virtual and smart work centers, saving the city money and reducing greenhouse gas emissions. In China, health professionals use telehealth to reach care teams and patients in underserved rural communities. So it's more about being there and less about getting there. And when being there does literally mean being there, emergency responders in Haiti had access to the people and data they needed to restore communications and save lives following the 2010 earthquake. Now it's possible to do more. With a partner who makes it possible to be there.
Well, welcome everybody. We're so glad that you joined us this afternoon, and I get the after lunch thing along here with Dr. Kennedy, my friend. After lunch is always exciting, so we tried to kick it up a notch, in the word of some famous TV speakers who cook a lot. So every day we're bombarded with seemingly just unsolvable issues. Things like healthcare crisis in our developing nations, education systems that are having challenges in getting education to their students, and things like natural disasters that actually cause displacement of people from their homes, not only thousands, but maybe even millions in many cases. And what's happening to us? We're not only hearing about this one time, we're hearing about it 24/7. And what that means is we're finding out about these disasters and these challenges on a regular basis, whether it be from our cable networks that are running 24 hours a day, whether it be through our social media, through Google newsrooms, our smartphones, even apps developed to help educate us on what's going on out there. And when you're an individual contributor, sometimes that makes it really hard for you to think, gosh, how do I make a difference as an individual? And sometimes it feels insurmountable. But what we're here to tell you today, Dr. Kennedy and myself, is we don't think that's true. We believe that when you put the power of a network behind you, that you can do amazing things. And by that, by a network, I mean technology and people. I mean that human network. The human network is critical in healthcare. And what we've seen is that by combining technology and the human network is we make exponential leaps and bounds in helping to solve some of these challenges. So with that, today we're going to talk a little bit about how we've done some work here at Lucile Packard to use our technology such as Health Presence, WebEx, and WebEx Social, a couple other technologies that you may or may not know about, to change the way that healthcare is delivered. Very exciting times. And when you were limited in what you thought you might be able to do, what we're finding is that by bringing people together, which we know Cisco does well, we can collectively join forces around the world to allow for you, other resources around the world, and talent to get together and begin to use the power in numbers to solve these major challenges that you have to deal with on a day-to-day basis. By connecting the unconnected, we're going to talk to you today about how we can impact healthcare. And in healthcare, bringing people together is what it's all about. but we have lots of other things like data that need to be considered. So we're going to talk about 3 different areas where we focus. Our customers are using technology and people to drive new business models to extend care out to people into other underserved communities where they can actually get care when they perhaps didn't even have a doctor before. We're using technology to help us put clinicians together to collaborate in real time to make decisions on treatment plans so that the patient can have the right outcome, a good outcome, and have it sooner than later, thus improving your patient care experience. We also are finding that our patients are becoming more actively engaged in their wellness programs. So we're going to talk a little bit about that. And what's really important with that is we do that both securely, so we protect the personal health information of the patient, and safely, so that the information that we transfer over to our doctors is going to be reliable and the right information to make an informed decision. So with that, I'd like to introduce you to Dr. Kennedy and ask Dr. Kennedy a question about his work at Lucile Packard. And first of all, Dr. Kennedy, what is it that led you to start looking at technology? It's unusual that a clinician would start to do something like that.
Sure. I happen to be a particular class of clinician, which is a pediatric subspecialist, where probably 1 per every 100,000 residents in the United States, and we tend to cluster at places like big universities, so access to us isn't quite easy for families who tend to live in communities far from these institutions. And we at Packard decided years ago that we'd try to break that mold and bring care back into the community. So we started outreach clinics, and they were phenomenally successful. Parents and children would love to see us in Monterey rather than travel all the way up to Silicon Valley to see us, or over in Walnut Creek. But with this, there's a huge burden to the physician of needing to travel back and forth. And some days I could be on the road 3 hours to get to one of the locations. And I would often sit back and think, well, that's 16 additional patients I could see if I didn't have to be in the car each day. So with that, we turned to technology as a solution and looked to telepresence as a solution for this problem of travel and interacting with our patients.
So how are you using the telehealth specifically? Is there a specific use case that you're thinking of?
Sure. We actually have the current state, which at Packard, we have 1 telehealth system set up in Monterey, and these are regularly scheduled clinic visits. So the expectations of parents and families are pretty high. If they're coming in for an elective problem, to see the doctor, perhaps surgery that their child needs, they really want to take the time and the effort to get the best information and best assessment. So we've turned to the Cisco telehealth system there, which is a virtual immersion into the human interaction. We can actually examine the patient with remote instruments and actually talk back and forth about those physical findings. We've actually duplicated that effort for the urban underserved up in San Francisco through our clinics that we've set up at California Pacific Medical Center. And in that setting, we'll probably move to the next state, which will be not only the elective clinic interactions, but actually emergent and urgent care. Many of the things we do as specialists happen unexpectedly and unannounced. And with that, we'll be using technology like the mobile cart you see to my right, where we can actually roll into a patient room, roll into an emergency room bay or an ICU, and we can actually, with the diagnostic instruments on there, listen to heartbeats, we can listen to lung sounds, we can get high-definition pictures of what's going on with the patient and talk to the parents right there on the spot. And that's phase 2 of our innovative process.
That is so exciting.
We are excited as well.
I can't imagine what kind of change that would mean for you in the way that you deliver care.
Well, I think it actually will make care easier for us because we're not burdened with having to travel great distances. We're not going to be tired from the interaction after being on the road for a great deal of time. And I think the same goes for our patients as well. I've often had parents arrive at the Packard site after spending 3 hours on the highway, and when they get there, the child is just completely upset from the 3 hours in the car. The parents are unwound by the whole experience on Interstate 880 and the traffic. And as you sit and talk with them for 10 or 15 minutes, they hear nothing of what you're saying because they're so tense from those interactions. And I think now, as we're talking to them when they've traveled 10 or 15 minutes, they're much more open to hear the information that we have to deliver. So I think it's really exciting from the point of view of parents as well.
So children, that's a really hard area to think about for me. I was an adult practitioner. I can't imagine how the children are potentially responding to this sort of technology. I mean, do they like the video? How's that working out?
Children just adore it, and perhaps better than words, maybe I can actually show you. I know that they caution you never to do live demos, but why don't we just go right into the Packard Clinic right now.
There we go.
And see if I can catch one of my patients. Hello, Kathy, are you there? How are things going in clinic this afternoon?
Good. We're here with Sean today.
Oh,
Hi.
great. How are you doing, Sean?
I'm good. How are you?
Very good. Well, I'm here on stage at the Computer History Museum, and you've got a couple of people watching you here on this interaction. Do you want to share with them a little bit about your medical problem that we take care of you for?
Well, I was born with tethered cord, and with that kind of comes some bladder issues and things of that sort.
Great. So we've been taking care of Sean since he's been a really small child. He's now 13, going to school right here in Silicon Valley. And he comes back for periodic visits to see us at clinic, maybe about every 3-4 months. And we take care of issues surrounding control of urination and urinary infections. So at those visits, we always need to get some ultrasounds. Maybe, Sean, can we share the ultrasound that was done at your visit today? Did we have one just beforehand?
Sure.
Great. Okay, so I see your bladder. Fantastic. Looks like things are going really well. I'm sure you're doing a good job with your catheterization. I don't see any debris, and the bladder wall looks really nice and smooth the way it should be. How about the kidneys? We know that that's what's really important. Okay, so we've got the left one there. Good, 9.5 centimeters. Perfect, just where it should be. How about the right one? Do we have the right views? Okay, good. We've got good blood flow, no scars. This is all looking great. Thanks, Kathy.
Great.
So, Sean, how are those new catheters that we talked about using? Have you started to use those?
Yes, I have been using those for the past month, and those work much better.
Okay. Are you finding it easy to use in kind of those quick on-the-go situations where it might be kind of hard to find soap and water?
Yeah, they're much more easier to pull it out and anywhere you can use it.
Great. And tell me about, you were just on a trip. Wasn't it kind of camp up in Tahoe or so? How did they work out there?
Oh, that was really fun. I went out to a camp up in the Sierras, and actually those catheters helped a lot more up there because you're kind of in a outhouse sort of bathroom.
Yeah, it's hard just for any of us to use an outhouse bathroom. It's probably much harder with catheters, but we're glad that you've gotten through quite successfully without any infections through that whole trip. So what does the rest of the year hold for you? Are you getting ready for Christmas holidays?
Yay!
Well, we know we've got you playing hooky from school today. Any fun plans for Christmas?
We're going to go up to Tahoe for a few days.
Great. Well, don't forget to pack the catheters. All right. Well, thanks so much. I appreciate you helping us out today. As you can see, nothing more that I can describe to you than the delight of a patient not having to travel in. And in fact, some of them find me friendlier on the TV. There was one day recently where I went to the operating room and all of my patient interaction had been through the video monitoring. And when I showed up to talk to the parents beforehand, the child pointed to me and goes, Mommy, there's my doctor from TV. You can imagine the razzing I took from the nurses after that.
So that was amazing. Really, truly amazing.
Impressive instruments and totally helps us out.
That's great. And I would imagine that Sean probably has a family that supports him behind his care delivery. What has the family experience been like with this sort of technology as well?
I think it's really great for families. Typically when people have to travel in to a place like Packard, only one parent can come. We all know the price of living here in Silicon Valley. two parents taking off from work, when we kind of surveyed our parents, 65% of the time they have to do that to make a trip to Packard. Whereas if we give the care back in the community through telepresence, we all of a sudden see that go away. They can come in on their lunch hour, do the visit, and not miss a day from work, and both of them can actually be there to see what's going on in the doctor's office. And in fact, we can keep a child from missing school as well. About 50% of the time, our children would have to miss school to come to Packard. So these are great social savings for them, and not to mention the environment with all that saved gasoline traveling back and forth.
Those are the kind of things that you don't think about when you're a nurse taking care of a patient when they come in to see you. From my perspective, that's the holistic view of the wellness of both the patient and the family. What a wonderful thing.
It's actually great technology because we can intervene actually quicker when patients have questions about their health. Typically, say the brittle asthmatic will wait to go into crisis and need to show up in an emergency room, perhaps even go to the ICU for a day or two for treatment. Now we can actually have them come to one of the remote sites, use a little incentive spirometer to see what their lung volumes are like, adjust their medications, and in 15 minutes they can be out of the office. It's just great, and we can prevent that whole cost to society of the emergency room visit and the ICU stay for 2 or 3 days.
That's great. So we have this thing coming in the States called the Affordable Care Act. I imagine you've heard of it.
We sure have.
There's going to be changes in reimbursement, and I wonder how that might be impacting you and your planned delivery for your patients in the future.
Well, I think if we look at the essence of the Affordable Care Act, it's basically delivering high-quality care at an affordable price. That one sentence sums it all up. And I think if you look at delivering care close to home with the use of technology, that's the solution. We can really, the highest quality of care without people spending endless amount of time traveling, and deliver it close to home where it's effective. We can interface with the specialists, with the community doctors. We can educate them along in our journey as well. So it's a win for everyone. And I think that's what the Affordable Care Health Act wants for the United States. I think one of the barriers is these technologies are great, but if we don't innovate on the payment systems, there are no physicians that will adopt it. No one likes to do work and not get compensated for it. And it's sad to say that sometimes the insurance system is well behind that, but I think in the state of California, the government has been actually very much on our side, and just in February of this year, they passed AB 415, which is a law that now enables us to be compensated for our government-insured patients for delivering care just as we've done here via telepresence. And that's phenomenal. I think that's one of the big steps in breaking down the barriers to using technologies like this. And they've also liberalized it so that we don't have to deliver care just to a hospital facility. We can actually do it right in the school setting. So all those children that are having psychological problems that need counselors 5 days a week, now on their recess, they can see their psychologist through telehealth. We can deliver care to community centers as well. So I think technology is going to be the solution to affordable health care.
That's great to hear. I'm glad to hear it's starting to be reimbursed, because there's just such value as you've proven here today. And I'm sure everybody out here is wondering, wow, how'd you do it? How can you help me understand the pitfalls, or what kinds of things do I need to think about if I'm going to implement technology like this?
Well, I think the first thing you need to do is assess your needs truthfully, and I think that's what we did. We thought long and hard about how we wanted to get care back in the community, and you start in small steps. First, it was delivering care in outreach clinics, and then it was expanding it to the use of telehealth. Need to find some rapid adopters. I happen to be one of those at Packard, and I've got many colleagues lined up ready to try it just as soon as we get the network mobilized to 3 of our locations. The other thing is to iterate kind of quickly. For instance, when we had to set up our telehealth suite at Packard, waiting for a room or office space could be 2 or 3 years in the making. So we actually converted a supply closet in clinic, and that's actually the telehealth suite. So my nurses often will say, well, Dr. Kennedy's spending the day in the closet again today, because that's what it took to get the program up and running rapidly. medicine usually works at glacial paces, but in partnering with Cisco and using the technology, we've moved things across so rapidly, and from concept to implementation, it was just under a year, which is unheard of in medicine. So I would say iterate rapidly, know your needs, choose the right technology for the job.
I think that's good sound advice. I'm sorry you had to spend time in the closet. However, with that, we're coming to a close. Any other final thoughts you might have to convey to the team here?
Well, I think that if we sort of look at the way this technology is going, I won't have to spend time in the closet all the time, because it will be mobile tablet computers, and I think maybe physicians will be going back to some of the basics of how we were trained. I graduated medical school in the time where we still had little black bags to make house calls, and that's unheard of now. But once again, I'll be making house calls, and it'll be a tablet computer, it'll be secure airwaves, it'll be USB accessible medical equipment, and we're pioneering that in our complex care clinic, where families with children that have 3 and 4 organ system problems that would need to be at the hospital every day of the week to see all the specialists, we can now make house calls to them at home through the use of this equipment.
Love that. Virtual house calls. Returning back to the old days.
Yes.
Love that. So with that, we have a couple offers that we want to talk to you about. First, we want to thank Dr. Kennedy. And of course, Sean and Kathy, if they're still listening to us behind the wings, really appreciate all your efforts to help put this together for this session, because I think seeing it brings a lot of life to it for everyone.
We're thrilled to share.
Thanks. So on your screen now on the sides, you'll see that we have a couple offers if you want to learn a little bit more about what some other customers are doing. The first is a digital magazine. If you have an iPad or an iPhone, you can actually download this application, and our first version that we're just releasing now has some content in it about how do you enable all these devices that are coming into the healthcare system and make them secure, and then also additional stories about our customers and what they've done from a telehealth perspective. We also have another thing that we wanted to show you. This is a really big book. For those of you here in the room that can see it, it weighs about 7 or 8 pounds, it feels like. Anyway, it's a great book. It's called The Human Face of Big Data by Rick Smolin. And what's interesting about this is Cisco is very interested in data. And when we start looking at data that we capture from the medical devices, from the sensors, from the satellites, from all these sources that are bringing us data, we can begin to visualize that data in a very different way that can help us begin to transform the way we deliver healthcare and wellness. So with that, take a look at the book. We do have a few of them here for you to take a look at if you want to go over to the Cisco table. In addition to that, there is a URL there in the presentation, and we have some cards that'll show you where that is on the table as well. The book costs $2.99 for the digital version, and that money is going to go to a charity. And what's the name of it again, Marianne? Charity Water. So please download that so we can all help make a difference here together. So with that, up next is Barbara Bush. Pretty amazing. She's going to talk about the Global Health Corps, and with that, she's going to talk about something that's very near and dear to our heart, how we can really exemplify the power of connecting the human network. So thank you.